Hey, I'd like to welcome everybody to another edition of Speak Easy Dental Podcast. It's been a while since I've done one. I'm so super excited today because I got two hygienists from Atlantic, Canada, and not from Ontario. Well, I'm not, you know what? I love Atlantic Canadian, so I gotta pump us up, right? So we've got two great hygienists from Atlantic, Canada, and we're gonna talk about what do hygienists want. That's going to be the topic. That's going to be the discussion. And I want to really introduce you to these two great hygienists that I've known for a while. Amanda Chater. Okay. She's a part-time hygienist. She graduated from Dalhousie in 2010, just recently got her BSc in science at Dal. Okay. We'll talk a little bit where she's going to go with that later. She's also a rep for a company called Paradise Dental Technology, and they basically sell restorative, surgical, and of course, dental hygiene instruments. Um, and she's also recently a rep for Microlim Disinfectant, which I want to hear a little bit about later at the end there, Amanda. Um, so she's a hygienist in Halifax, Nova Scotia, and we'll get to talk to her a little about that. The second one I've known for a while. I've heard her lecture, I've heard her talk. Nadine Hassanain, okay. Hassanain, right? Okay. She
Fascinating. That's good. It was really good. That was amazing.
Oh, awesome. Thank you. Thank you very much. And she
That was perfect.
graduated from Hygiene 20 years ago. So she's got a lot of great experience. She graduated from the Canadian Institute of Dental Hygiene in Ontario and also a BSc grad. Okay. She has taught dental hygiene and developed continuing education program for many years. And I've heard her speak on certain topics, and she's absolutely phenomenal in that department.
Thank you.
She loves being a hygienist and currently practices also. Okay. Also, which I've had a demo of, and with these particular ergonomic loops, they're pretty amazing. She's also a rep for Down Medical. And if you ever get a chance to try them definitely. So, ladies, how are you tonight?
Great.
Great. Thanks so much
Awesome.
for having us.
Oh, I'm excited about this podcast here. So, tell me, first of all, I guess I'll begin with you, Nadine. What made you become a dental hygienist?
I often joke because my mom made me. My mom was a dental assistant. She actually used to work here, and I think it's Dr. Lovey, who was an oral surgeon at the VG. My mom used to be one of his assistants back in the days, back in the 60s. So I was actually an assistant for 8 years before I became a hygienist. And my mother actually really encouraged me to continue my education and go on to do hygiene. So it's my mom. It's my mom's fault. So yes.
Well, your
She
mom
she
really.
ingrained she ingrained it into me at a very young age. So that's why I became a hygienist. And
Well,
a lot of family members, as you know, of mine are in dentistry, and my niece is graduating hygiene this in a couple of months, actually.
oh,
So she
great.
just finished hygiene, and she went to the school that I used to teach at. So all of my friends are teaching her, and she's just going to be fabulous, and we're so excited for her. Yeah.
Hopefully, you're thanking your mom every day there, Dean,
I
because
know, I do,
yeah.
yes, yeah. Yes.
What about yourself, Amanda?
Why I became a dental hygienist?
Yeah, what made you get into that field?
Um, I always loved teeth. It was the first thing I noticed when meeting people, but I also went to school with I'm very fortunate. My parents paid for my schooling, and they're immigrants to Canada, worked very hard, so I didn't want to waste time because time means wasting their money. So I'm like, what program can I try to get into? Dental hygiene at the time is very hard to get into. I actually got accepted a week before school started. So it was pretty fast, quick. Yeah, and also my brother is a dentist, and at the time he was already 2 years into dental school. So I thought, you know what, let's just do it. It was meant to be.
Wait, one of the reasons we all got together for this podcast because was a post that I wrote about dental hygienists and basically asking, what does a dental hygienist want? So basically, this is where we are today with all three of us. So I guess the biggest question today is like after COVID, there was a lot of changes in the dental hygiene field. A lot of dental hygienists retired, right? And obviously new ones came in. And then it's a whole new world with dental hygiene. I'm just speaking from a dentist perspective right now, right? We have a shortage of dental hygienists. I find that, dentists themselves, have to really create a great environment for dental hygienists. Okay, as far as ergonomics, get the right seat for them. And I also find that we're putting a lot of tasks on dental hygienists these days instead of kind of floating away from what you guys really do well, scaling and root planing and educating on oral health. We're laying a lot of stuff on you and stuff. One thing I noticed is, if you want to elaborate a little bit, is iTero. Basically, a lot of hygienists now, after cleaning, are being requested to take an iTero scan. Now, how do you feel about that? How do you feel? Does it take away your time for actually giving that client a thorough oral health cleaning?
Do you want me to go first, Amanda?
Sure.
Um, I think that having visuals is great. I've always really encouraged to take, intraoral photos before and after. So the iTero or any kind of scanning like that is another visual image to help us communicate. So I'm all for that.
Right.
Um, I've tried to do a scan in 3 minutes because they tell me I can do it in 3 minutes. I'm just not enough, I guess, to do it that quickly. And I do feel like that is one more element that gets added on to our typical, 1 hour appointment. Obviously, I would love to be able to do every single thing that is expected of me within a patient's appointment, but it's one more thing that gets squeezed in. But I do think it's a very powerful tool, and it's definitely, an asset to helping with any kind of communication or education for your patient.
Now, both of you are experienced hygienists. Okay. So, with a hygienist that's just graduating out of dental school, or maybe, no, sorry, hygiene school, or maybe hygienist practice for less than 5 years, do you feel that's putting a lot of pressure on them within that hour to do that?
Oh, it's
Yeah,
putting a lot of pressure on me.
Hmm.
I've been doing this a long time. Like it is a lot of pressure. It is a lot of
Yeah.
pressure. Yeah.
Yeah.
I agree. If there was like a second chair for the dentist where they have a second assistant to put that patient in their chair for the assistant to do that and then pass them off to us. I mean, again, this is something we'll probably talk about throughout this podcast, but being like a team, like passing the baton to each other and just helping each other out in that way, because there's a lot that can happen in 1 hour and you don't know what you're getting, right? I fill in at offices, so I go in there blind. It's like I have first dates all the time at dental offices.
Dental
I get to
office.
know everyone for the first time. Okay, so
Mhm.
there's a lot I have to do within an hour.
Yeah.
You know what? Yeah, that's a really, really good point. Yeah, I've always envisioned that maybe, if, especially if it's a busy office or multiple offices, maybe hiring a dental assistant to kind of scan everybody that wants to get scanned, right? And allow the assistant to educate the client too, right? And that just makes it easier for everybody. And like, if a patient walks in and gets scanned first, then they're passed over to you guys. I think they would even enjoy the cleaning even more, and they could put more priority on it because they've already seen
And you
their
can
scan.
educate them with what you see, right?
Yeah,
This is how you
yeah,
came in, and this is what we see, and you can
yeah,
educate them that way.
absolutely.
I'm a firm believer, and maybe this is going to be another question later on that we're going to talk about, but I'm a firm believer. Why would you pay me to do something that an assistant can do?
Yeah,
Okay. So
yeah,
that's one thing, like dentists talk about, like, well, we pay hygienists this X amount of dollars or whatever. And I get it. Like, I understand the whole business of dentistry. I completely understand. But I think an important aspect of that is, I can do all of those things.
mhm,
But I think it would be more advantageous and the time would be better spent, especially because we have more things that we're trying to do in that 1 hour appointment. And, you know, patients are like behind or having more difficulty scheduling them, making enough time into the schedule. So asking me to do one more thing in my appointment is taking away from services that are really needed for that only I can do.
mhm. I
Does
agree
that
with
make
that.
sense?
I agree with
Yeah.
that. That kind of leads me to the next question, actually.
Okay. Sorry.
So,
Good. My
big
segue.
topic, big topic right now is, what do I pay a hygienist? Okay, that's in the dental hygiene world, the dentist world, right, and stuff. So besides pay, what appeals to a hygienist with respect to benefits?
I mean, I don't really need a scrub allowance, so you guys, they can keep the $100 allowance they give out to their staff.
I
Really
love that.
don't need that. Because that will just pay for a scrub top at this point if you're into the whole figs
Yeah.
line. Um, it's just to me, so now I fill in at offices, right? So I've been doing that for basically a decade
Mhm.
at this point. So I'm not looking for extras. I just want to get paid for what I'm worth and I know what I'm worth. Um, because I know I am a great hygienist. I'm not a perfect dental cleaner, let's say, but I care about people. I like being preventative. I love putting people down the right path. I love giving people the options. I love listening to people and understanding them. And that's one thing I learned in school was patient behavior. You know,
Mhm.
I walk into offices to fill in, I get a dentist or hygienist or staff member say, listen, your next patient's a bit difficult. Those are the people I love. Like, I
Yeah,
just
but
want to understand.
I understand where you're coming from, Amanda, but why have you not chosen to be a hygienist at one permanent office? Like, what appeals to you from going to other dental offices?
So I do sales, right, on the side. So for me to be a better, I hate to say salesperson, but an educator on my products, I like to understand different offices. I like to understand their environment. Do you know what I mean? It helps me understand how to approach clients with the products I have in hand to talk to them about and how it would benefit them. My life is based on a hygienist and as a salesperson, I want to make people's lives easier and better on both aspects.
I actually love that what you just said. You like to see the different systems in the dental offices. So how much variation is there between one dental office to another? I'm sure, like I know myself, the consistency is not the game here, right? And stuff. But do you see a great degree of variation when you go from one office to another?
Yeah, I mean, now is a time where I get a lot of hygienists that I barely even know. They reach out to me through social media. Like, listen, I know you've been filling in for offices. How much do you get paid, and is it worth it? Okay, put away the money aside. It's not meant for everybody, you know. Like mentally, you go in there and like I'm a type A. You can't be like type A when you're filling in. You get
Yeah.
what you get. You
Mhm.
don't like it, you just don't come back. You don't burn bridges with people. You just, you know, just say respectfully, I just can't go in there again.
So that kind of same topic, and that kind of brings me like the ergonomics of working in an office for hygiene. Like I know, okay, so your instruments, for instance, I know they're great for ergonomics, the way they feel, the way they work, right? Then you have the actual stool itself that you're sitting on. Do you find a lot of offices are accommodating to hygiene for that kind of stuff?
Now they are. I think since COVID happened, the pandemic happened, it shook the world up a little bit. It shook dental owners and offices up a little bit where they're just like, okay, we can't keep saying no to these people. We need to keep these people.
Yeah.
We need staff. How are we going to keep, if they're asking for $1,000 chair, whatever, let's give them that $1,000 chair. We need this hygienist not only to stay, but their longevity to be
Yeah.
at the.
Okay. What do you think, Nadine?
One of the products that we actually sell at Endowed Medical is chairs. Currently, we're carrying a chair called the Posiflex. It's an amazing chair, and sometimes dentist owners or the clinicians themselves that are purchasing it say to me, "Well, that's very expensive." Okay, so you're going to spend 1,000 to 2,000, whatever it is that you're getting for a chair that's going to last you longer than your couch.
Yeah.
And you're going to be sitting on that chair every single day for 8 to 10 hours, sometimes 12-hour shifts.
Mm.
You want to give your team, you want them to be comfortable.
Yeah.
Why would you want someone to be in pain? Why would you want someone to be uncomfortable in their workplace that they're dedicating their time to you, right? So to me, ergonomics, right? Well, obviously, I mean, I'm very passionate about ergonomics. That's how I ended up with my job at Andau Medical from my own ergonomic journey. And I'm actually taking my full certification. I'm halfway through my full ergonomics assessor's course. So that is so important for our longevity in our career. And not that dentists or assistants don't have that, but from a hygiene point of view, our skill set is very repetitive. and we're kept in the same, dentists have multiple procedures and you're doing different procedures all day long. So I feel like you get the opportunity to move around a lot more. We're sitting there for an hour in the same position, maybe only moving from 9 o'clock to 12 o'clock, that little bit for 45 minutes straight. So holding those positions can be hard on us, not having proper ergonomic instruments, good instruments that are sharp, and having the time to maintain our instruments is something that's vitally important to having us have longevity in our career, right? So not investing in those very basic things, you know, that's one big thing. And I feel like, I've known a couple of hygienists who've turned down offices because of the ergonomics of the operatory. It's like, I'm sorry, I can't work here. I've heard them say, I can't work in this room. It's impossible. It's going to kill me.
Those are great points, and it applies to dentists too, right? So,
Absolutely.
you know,
Absolutely. You got to
yeah,
protect your body. We only
yeah,
have one body.
yeah.
That's
Yep,
it. We
yeah,
only have one body. So
exactly. So I'm just going to go to that question again. First of all, I loved all your answers. What
mhm.
other benefits do you think that would attract hygienists to an office?
Can I contribute
Yeah.
a little bit?
Yep.
So I feel that my needs have changed dramatically throughout my career. Like when I was, younger and a newer hygienist and my children were small, I had to find something that I could leave my job on time to get my children. You know what I mean? Those
Yeah.
needs aren't so great. My children are grown now. They're independent and I don't need to be done and at work by 5 o'clock. So I think that flexibility in scheduling and, you have to realize that these people they have families, right? And they have a life outside of work. So respecting that is one thing that I feel like that having that kind of flexibility in scheduling. Because sometimes when you're committed to an office, you have these are the hours that we work and this is what we need you for and this is your job. So sometimes that doesn't always work. And I feel like nowadays people are being a little bit more flexible in the hours that people can work because, to help accommodate things like family.
Yeah.
Um, for me, I'm older now, so having an RSP contribution, that would have been great for me first when I was starting my career. Now to me, it's not like that's not going to make or break me. Like, having an RSP contribution at this point in my life for myself personally. Having benefits, offering benefits, not just in-house dental, but, benefits so our kids can get braces, things like that. Like I started off my career, I never had benefits at all. Here in Nova Scotia, statutory holidays aren't covered as much as the rest of the world. I remember first when I came here and I was working at an office, 3 days a week, and I didn't get paid for it was either Thanksgiving or Easter or something like that. And I was so upset that I didn't get paid for that. And I didn't realize that, you have to work a certain number of days in order to, per week to qualify for stat holidays. Well, if someone's still dedicating their time to you, even if it is 3 days, that's 12-hour days, that's a full-time job.
Hmm.
Give your staff stat holidays and not just what's required by law.
Yeah.
Make them, what is the incentive? What's the incentive for someone to stay? Because, we can, get jobs that don't have great conditions anywhere. So why not offer your staff, if you really care about your staff and you want to build a great team, because that's really the whole point of it is building a great team, right? Treat them
You
like
know,
your family.
I really
Treat
love
them
the
like your
work.
family.
I like the work balance thing. I love that. And I also like,
Yeah.
so
Yeah.
nowadays I see like, hey, if you reach this certain level, you'll get a certain incentive, or if you reach this level of production, you'll get another incentive, right? So
Mhm.
I understand what you're saying. I appreciate it. I like the fact that, hey, just randomly, hey, you had a great day. Awesome. Here's a gift card for you, type thing.
Yes.
It's
Yeah.
like giving flowers to somebody when they don't expect it.
Yeah.
Right? And I love that. I
I
love
used
that.
to have a boss that would do that for me every now and again. He would just like, because he knows I love my Starbucks, he would just slide me a Starbucks. He's like, thanks for like a really great week. And he
Yeah.
would just give me like a
Yeah.
Starbucks card. So he's paid for my Starbucks for the whole, those little things really go a long way because I think that's something that is unique and
Mhm.
specific for that person. It's not like, okay, a team is getting the whole bonus. No, it's something that they recognize that you
Yeah.
kind of stood out that week and you've done something and it's nice to be appreciated. Everybody wants to feel appreciated, right?
Absolutely. 100%.
Um,
Yeah.
you
Yeah.
know,
I
but
mean, you
I
guys,
think my whole point was offering versatility in employment contracts or conditions, right?
Yeah.
What's good for me is not what's good for Amanda and vice versa. We're at different points in our careers and we have different needs. So not saying, okay, well, this is what so and so gets. And, this is what Amanda gets, and she's worked for me for 10 years, so
Yeah.
that's all you're going to get. Do you know what I mean? The exact same conditions. It needs to be specific to that person. And I think that if you have a little bit more flexibility, Amanda doesn't like it. Amanda doesn't need uniforms. Maybe I
Yeah.
want uniforms,
Yeah.
right? Do you know what I
Yeah, I
mean?
So,
wasn't speaking for everybody, no. I was
yeah.
just speaking for
No,
myself.
no, no,
Right.
no.
But
I
I'm just saying,
understand that,
but
but
what
you
I'm
got,
saying is like
yeah,
that need is not something that, so give her something else that she does,
absolutely.
right?
Yeah.
You
Yeah,
know?
so it's interesting you said that because you guys know I used to work for a DSO, right? And
Yes.
man, I love McDonald's. Everybody knows that, right? So one month I was hoping I get
Not to love about McDonald's
McDonald's
fries.
gift card. I never did. That's all I got to take to satisfy me. You know what I mean?
Here's some
Uh,
fries. Here's some
yeah,
fries for
exactly.
McDonald's. Perfect. What's not to love?
The other question. Of all the offices you guys have worked, you don't have to mention the office, right? What's the best culture that you've ever experienced in an office?
An
That's a
office that it was the
I did
same it was the same dentist that would give me my Starbucks gift cards. It was very much like I felt appreciated and valued for my role. And he also had the hygiene department set up that we had an assistant available for us. He really ensured that our patients were getting top quality of care. We always perio charted every year. If we weren't doing bite wings, the next visit we were perio charting. We had an assistant to help us, and that was made available because it was important to him. He's like, why am I doing all of this work and the foundation is shot? Like,
Mm,
there's no
yeah,
point. So he really kind of saw the whole picture. And the way that the hygiene program was established there, we were rarely supported. So we always had our own assistant in that office to and they would rotate because there was three assistants and they would rotate who was assisting us that week so that nobody would the assistants wouldn't they had a variety in their tasks as well. So I wasn't spending time sterilizing instruments. My time was for patient care,
yeah.
right?
Awesome.
So that was the culture, and the culture was that what our patients needed was priority.
I
If I
love that.
needed instruments,
Mhm.
all I had to do was say what I needed,
Yeah,
right? Within reason, obviously. Like I couldn't just say I need $10,000 worth of instruments. Like that's not going to happen. Like, but
yeah,
you're
yeah,
responsible
yeah,
for
yeah,
providing care, and you need to have good instruments to do that.
yeah.
And that culture, we routinely had, staff lunches, staff dinners, and staff meetings. And we
Mhm.
had a morning huddle every single morning so that we all knew where we needed to be supported and where that team member needed to fit in, what you needed me to do. So I think that, the key is like excellent communication and knowing that we are all a vital part of that team. Everybody has a role, and we can't do it without every single member of that team.
Absolutely.
So
100%.
that was the culture. Like we were all very valued, and that was the longest office that I had ever worked at as a clinical hygienist. So
I like that word, very valued. What do you think, Amanda?
I agree. I honestly now have been super fortunate that the offices I filled in for, they treat me really well. I go in there and I work. I never bring anything personal into work. I come in with a smile, leave with a smile. Um, like I've had offices when Christmas comes and I'm only filled in a few times for them, they send me a Christmas card with a gift card in there, or it's hygiene week, here's some flowers. Here they notice like healthy snacks I eat. They'll make me a little gift bag with the snacks I enjoy and stuff like that. I find even when I fill in a simple, thank you for coming in and helping me. I get awkward with compliments. People that know me well know that about me, but like I do accept those thank yous because yeah, they should be thankful. You know why? Because there's people that hygienists that book in with them and they cancel the morning of. I don't do that. I show up. It doesn't matter what it is. It could be a snowstorm, even if it's for that first patient and I need to leave. Like I don't like leaving people high and dry. I don't like people
Yeah.
panicking. I get the same respect that I give back, really. And I feel like I have a good relationship with most offices that I deal with.
It's funny you both mentioned this. One thing I've always done is every time I leave the office, I'll thank everybody from the receptionist to the assistants to the hygienist.
You
It's just the
do.
way it's just the way I was brought up.
You
Just
do.
not that, just as for appreciating. And it's
Yeah.
funny, I always get comments from everybody saying, "Hey, you're the only doctor that said thank you when you leave, right?" And stuff. But
It's so
that's just
simple. It's so simple
yeah,
to thank our team.
exactly,
Like it's so
exactly.
simple. Like
Yeah,
I thank the assistants every single time. Like, and I tell them like I appreciate you. It's
yeah.
so simple to do, and
That's
it's
it.
not, you know,
Yeah,
and I don't expect to like somebody to say, "Oh, Nadine, thank you so much for coming in and doing your job." It's not like that at all. It's
yeah,
just a simple appreciation that we appreciate
yeah,
all of us together. Like,
yeah.
thanks for a great day.
Exactly.
It's so simple to do.
I love that. So,
Mhm.
what are your thoughts on the commission-based structure for hygienists?
It's, it's the only way I'll commit to an office.
And why is
For
that?
me, why is that? Because it's based on my productivity. It's based on my productivity, and I know what I'm capable of, and I know what I can do.
Mhm.
And for me, I feel like I think that there's going to be, you're going to see it more and more in Nova Scotia. In Newfoundland already, most hygienists work on a commission basis, very similar to an associate, because we know that what hygienists bring to a dental practice,
Yeah,
it's so valuable. It's so
yeah.
valuable, you know, and I feel that I deserve that. I work really hard. I'm a very hard worker. And for me, that's the only way I'll commit to an office at this point is if I'm being paid on a
It's
commission basis.
interesting you say that because the hygienists that I usually work with in the office and stuff, we presented that before commission, and I agree with you, everything you said there. But some of the hygienists came back and said, "No, I want a regular salary. I'm budgeted. I want to know what I make every 2 weeks." Right.
Exactly.
And then I go back and I look at the production. I'm like, wow, this person could have made a lot of money if they went with that commission structure, right? But no, it's no, this is what I want, right? So
And and I think it goes back to the stages of people's lives. When you're young and you're starting out and you're getting your first mortgage, you and I know that they're not going to look at
yeah.
commission when you go to the bank, right?
Mhm.
So, I mean, I'm older, I'm a more financially established than someone who's, 25 or 30 years old with young children.
Yeah,
So, for me, I don't need an hourly salary. I would rather on a commission basis. So, and that's where I said again, like, the flexibility in the employment contract, right? And I also know that if I don't have a patient, I
yeah,
don't get paid, and that's a chance. That's I'm okay. I'm okay with that. I know that in the grand scheme of things, it might that one day might be a little bit less, but other days it'll even out,
yeah.
and and I know that the current climate in dentistry, that we're all busy. I don't anticipate that I would have huge holes in my schedule.
Yeah,
Everyone needs a dental appointment, especially with the launch of the CDCP. There are people waiting to
yeah,
get hygiene appointments, and
yeah.
it's even hard right now to get patients booked in for, a 4 or 6 month recall. They're being pushed back to
So
6 and 9. So
yeah,
I know that I'm going to have a full schedule. So I'm
it's
not worried
interesting.
about that.
One interesting thing I got from you was the from the commission structure, and I agree with it too. And I never really thought of it until you mentioned it, is the age of the hygienist. If it's a younger hygienist, they want a salary. Da, 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 da. That's a good tidbit. What do
They
you?
need to know exactly how much they're going to get every single.
Yeah,
And I was that person. Like, I know I needed to know. Okay, this paycheck is going to be X amount of dollars because my mortgage is this. I pay this much
yeah,
for my car insurance, my car payment, all of those things. I'm a little bit more established where
yeah.
I don't necessarily have to count on those things, right?
No, I like
So
that. What
if I
did?
had one check that wasn't as great,
Yeah,
I'm okay. It's not going to make or break me, right? So, whereas a younger hygienist who's just starting out or have a young family, they really need, to
yeah,
count on their money. Hmm.
100%. What do you think, Amanda?
I agree. I mean, listen, this was like, I think 13 years ago. I was in Newfoundland and a hygienist that I know that I went to school with, she's like, yeah, I get commission here. I'm like, what do you mean commission with hygiene? So she's basically was in control of her own schedule. Like she got a little space in her schedule. Someone canceled or rescheduled. She can text a friend or something, call one of the patients to fill it up if she wanted to. They've been ahead of us in that aspect. Honestly, Anil, I feel like Nadine and I are on the same page when it comes to dental hygiene, like what we can give to the patient. And like sometimes at the end of the day, I love my job, but I'm tired because I'm like I put so much out there, but like what I get paid an hour, a lot of dentists would be like, "Whoa, that's a lot." It's like the outcome of each one of those patients is going to be like 10 times of what you're paying me per hour. Like I'm not just cleaning teeth. I'm talking about treatment. I'm educating these patients. I'm actually getting to know them. Like I try to learn three things about each patient that sits in my chair because everyone there's I think about 70% of people dislike coming to the dental office. So I want to make the experience good for them that, they're hanging out with a friend. Like I think we both bring in so much more than just cleaning teeth,
Mhm.
but I'm at the point in my career where I'm just like it's tiring at the end of the day, but I'm like is the paycheck matching up with what I offer this office? Do you know what I mean?
Absolutely. And you know what? I'm going to add something to that too. As dentists, we're not really a lot of business people, right? Most of us aren't, right?
Some
But
are very good and some are
yeah,
not.
and I'm going to probably get crap for saying this, but I'm going to say it anyways, right? Because I'm more of the entrepreneurial business type dentist, right? And Mandy, you made a really, really good point that I really like. So the hygienists are the engine, right, that keeps the patients coming back. All
Mhm.
right. They keep the loyalty there. Okay. You do recall exams, right? Hey, you might find something, you might not, right? But to me, it's all about that patient experience, right? So if I got to pay extra for a great hygienist for a patient experience, and I know they're going to come back every 6 months, I don't care,
Mhm.
right? And stuff. So I agree with that totally, what you said. To me, it's all about the patient experience. And I've seen it and I've lived through it. And I've seen like patients are very observant too. Like a lot of dentists don't understand how observant patients are, right? I was in a clinic and there was a garbage can in the corner in which the patient could see, and they did not like that look while they're getting their teeth cleaned and stuff. Like so little things like that. So
You
like
know,
even if a cleaning, let's say, it's about 250, whatever, da 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 da, and you're like let's get it out there, right? So some hygienists are getting paid $60 an hour, some are getting paid more than that, some are getting 42. Like, Amanda, you're hitting the nail on the head here, which really got to get out here, right? Is that there's still a lot of profitability in that for everybody at the end of the day.
Absolutely.
Okay.
No,
And
I'll give you an example. Today, I fill in an office I absolutely love. Probably one of the best offices I've worked in a long time. They treat me so well. Like it's great. I had a patient in, young guy, missing tooth, endo tooth went wrong, had to get extracted, tooth behind it, endo tooth, big filling on it, not crowned. He's basically my age, wearing down his teeth. Anyone go through like a treatment plan or option with you? He's like, they did, but it didn't really register with the patient. So, like, obviously, the way it was presented to them, they didn't really understand how important it is to have those missing teeth filled, especially when you have a bite issue, grinding,
yep.
clenching,
Mhm.
and endo teeth in there. And then when I explained it to him, he's like, yeah, let's do that referral. So send that I'm like, what is it gonna, it's not gonna hurt you to go get educated a little bit more by a specialist to tell you what exactly it's gonna
Yep.
go. That way you're not fabricating, making up these numbers and costs in your head and outcomes. At least someone professional is sitting there and telling you, these are your options.
And
What hygienist that fills in does that?
none, if I can think of, not a lot of them anyways, because they're just there to fill in, right? And
Right.
stuff. And what I love
They're
about
just
your
there to get the bill.
But
They're checks.
what I love about your story and where probably Dean said a permanent office and stuff, right? Is that when the dentist comes into the recall, they're rushed.
Mhm.
Okay. Look, yeah, look how Vitamin said that. They're not gonna have time to say everything that you just said. okay, and stuff. And what you just said to take that patient to the next level not only creates loyalty, but creates word of mouth, right? Hey, I saw a hygienist. She told me this and this. What, your hygienist told you all that? Right? So it creates more word of mouth. I've seen that happen before. And I know like when a dentist come in, and I'm going to put myself in this picture too, because it's a busy day and stuff,
Yeah.
and you're looking through the bite wings and all this stuff, and you're going, yep, okay, you're good. See you later, right? But then when you walk away, you're saying, oh man, there was a lot of attrition on those lower anteriors and upper anteriors. And the guy's a clencher. I didn't even mention a bite plane to him. Well, that's affected him, right? Because you're rushed, right? But when a hygienist basically explains it to a client, which I've noticed, they'll listen more to you guys than me coming in for like 5 minutes,
Yeah,
right?
but I'll
And
add on to that. Do you know what will make it sit with them? Is if the dentist respects the hygienist enough to allow her to do her job.
Yeah.
I work with a dentist like fill in, and I don't get not a good vibe from them, but like we don't, I respect them, but there's no like laughing or bantering and stuff like that. And I just know it's not gonna be a good fill-in day for me. It's just gonna be cleaning teeth and we're not gonna be eye to eye and stuff. But if
Right.
the dentist in front of the patient shows that great relationship we have and that banter and that respect,
Yeah.
that just made the patient just like lose 100 pounds. Like, wow, okay. I don't have to listen to him telling me I have a bunch of cavities. He trusts this girl or guy that's cleaning my teeth. I'm going to
Mhm.
listen to them.
Yeah.
I know it's not hard. You get a
Yeah.
new patient that calls in.
Yeah.
That new patient should be in the second dental chair.
Hmm.
They take a pan, full mouth series, and a scan of their mouth.
Yeah.
They do their exam, pass them off to the hygienist. The
Yeah.
hygienist will do the talking and
Yeah.
Yeah.
educate them and show them pictures. Do the exam and x-rays and scan. We'll do the rest. And then if we don't finish the hygiene, we book them back to just to do the hygiene part. We don't
Yeah.
have to book them back to do x-rays or anything. Like to me, how offices don't run like that is mind-boggling. Like I
Mhm.
go to offices, a patient comes in, they're taking bite wings, 4 bite wings. Okay, well they have an endo on the anterior tooth and an implant. You're not going to take a PA or a pan?
Mhm. Yep.
Thank
So,
you. I'm
Because
always taking
doctor's
anterior
not
PAs.
going to
It's
do
like,
that.
I
Like,
need my
yep.
anterior PAs.
Yep. I
Yeah.
always say, like, I want to hire people that are like an NBA All-Star team. Pass the ball.
Yeah.
Right? And at the very end, dunk
Or,
it in.
or you want to have somebody that you can communicate, like, you
Yeah.
say to me, hey, Nadine, in our morning huddle, you know what? I noticed that, Amanda didn't have her anterior PAs the last time. Can you make sure that you get, and that's
Yeah.
respected and we do that. Do you know what I mean?
Yeah.
I love to have the autonomy to do what I feel that I need to do. And if I feel that I need to update, anterior PAs or whatever it is, for me to be able to effectively do my job, monitor bone levels, I like I'd like to have the autonomy to be able to do what I feel that my patient,
Yeah.
our patient
Yeah.
needs,
I would love
right?
that. Yeah.
Yeah.
Absolutely.
Yeah.
I mean, correct me if I'm wrong. A lot of dentists are really right now, I don't know about you and now, but a lot of dentists are like, I need my hygienist to perio chart. Okay, I need them to perio chart. Two things. Do you know what perio means? Do you have the instruments for your hygienist? Probably not. You don't have after five. You don't have extended reaches. Okay. Also, your patients, you're never taking a pan on the patient. So, like, how am I going to see the bone levels that I'm working with and looking back at? You're taking bite wings only. Like,
Great point.
you're going in there blind
Yeah.
first. Like, X-rays are so important.
Yeah. Yeah.
Like, it's the angulation. If you're just probing, you could just be off slightly and not probe properly and get the
Absolutely.
right number.
Great point. Great point. And that's
And
why when
yeah,
I set up my new office, it's going to be AI probing. Okay. So the
that's
probing goes
amazing.
right into
And
your
you know
chart,
what?
right?
Probing is probing is part of the new patient exam. The very first time they see the dentist, that it
Yep.
should that we
Yep.
should be gathering that baseline
Yep.
information, not
Absolutely.
left to whoever,
Yep.
to do at a later date. It should be done at the new patient exam. That's part of what
100%.
we're billing, right?
Yeah.
So, yeah. But
So,
AI to help us,
yeah.
amazing.
Yeah.
Amazing.
And also transcribing notes right into your chart, right? Just make it
Amazing.
more, right? So, this is the last question, then I'll leave it up to you guys. Uh, so if you ever, either one of you, I know you probably have worked with a DSO. What are the differences of working in a private office versus a DSO?
I have worked for both. Um, I have liked opportunities working with a DSO. I do like, and you know that I have quite a few friends who work for some bigger DSOs. I know a lot of people, and they have great positions and great jobs. Um, the priority is always our patients.
Yeah.
Of course, dentistry is a business. We wouldn't do it if we weren't, making a profit doing it. Obviously there is the business, but when the business needs supersede patient care, that's when I have an issue. And it depends, quite frankly, on who is managing. And you need to have somebody with a strong dental understanding managing these DSOs. Not people who've managed Dollaramas, not people who have managed, and I'm not saying that they don't bring something valuable, but we need to have dental professionals. If you want someone running a hygiene team, who better to do it than a hygienist?
Yeah. Hmm.
Right?
Hmm.
So, and I get the dollars and cents. Absolutely. I'm not disputing that. We all have to be accountable for our time. I talk about that a lot. You know, I I I am 100% accountable for my time. I love being able to explain to people why that is so important because I value what I do. And when you pay me, you want to value what I do,
Yep.
right? So it's about being accountable. But I really feel that, you know, working with people, whether it's a DSO or a small mom and pop shop, you know, it needs our patients have to come first. Patients and
Yep.
patient care have to come first.
Yeah,
You know,
I'm going
that's the
to
bottom
ask
line.
you a second too, and it's interesting, Nadine, that you said that because it just goes back to the same old thing. I had a friend of mine the other day. He was like getting some advice about getting divorced, right? And I said, "Why are you asking a happily married couple about getting advice on divorce? Like, why don't you ask somebody that is divorced?" Right? So it goes back to what you said about, hey, we need dental hygienists to manage and not people from Dollar Rim. That's the same thing, right?
It is. It is. Yeah. Ask the right people. If you want to manage a team effectively,
Yeah.
ask the right people to manage them.
Oh, that's great. What do you think, Amanda?
Yeah.
I haven't really had an issue with them, but I always say when it comes to creating my ideal dental office, that doesn't matter if it's corporate or non-corporate.
Absolutely. Yeah.
A manager that is a retired accountant or a retired dental associate or professional would be great to manage an office. And the best people for receptionists are retired assistants or hygienists.
I agree with that 100%.
Like that would be a dream of an office, someone that actually understands or someone that's dealt with that worked for Blue Cross or
Yeah.
Manulife, someone in insurance or anything like that. Um, I don't think I think it's slowly changing. Like I say, every graduating dental class, there's a 10% of them, there's a dentist that has a business mind frame that will
Yeah.
probably be a business owner. The rest will be associates.
Hmm.
It's not easy. It's not easy for any business owner nowadays.
Yeah.
Right now, as a dentist owner, that's not an associate. I don't know how they sleep. You can't find staff. Everything's going up in price. Um, it's a nightmare. Like you can't even enjoy your job or your career.
Yeah. Yeah. I agree with that. That's great. Um, okay. So I'm gonna wrap this up because it's very entertaining actually and very actually I've learned a few things. I wrote them down. So which is great. So we'll start with you, Nadine, and we'll wrap it up with me, Amanda. I know that you a representative for Mandel Loops, and you did a demo for us. And by the way, that was an awesome demo. Okay,
Thank you.
stuff.
Yeah.
And one thing I respect for both of you guys is that you're just not hygienists; you're also representatives for companies. Okay, and when you speak about a product, it makes it more believable because you're using it, right?
Yeah.
So,
Absolutely.
and I'm not knocking down sales vendors when I say this either, okay? Because I got a lot of respect for a lot of great sales vendors, okay? But I always find when somebody's trying to sell me a product or do a demo on a product and they're already using it, I find I get more faith in that product, right? But I also find somebody that is well educated on a product, you know, they'll use it at home, but they're not dentists or anything. But they'll use it and they'll try it, and they're also good too because they tried it. They just don't read the literature on it. Okay, and I've got a couple of great vendors that do that also, right? So Nadine, with yourself, how do you find like breaking that time up? Being the hygienist and also, and I know you work hard, girl, because you came at 5:30 and 6 o'clock at night after work to do a demo for us, right?
I did, yeah.
But
Yeah.
how are you finding that? You know, that.
I I'm very passionate. I'm a very passionate hygienist, and I always say that I will never give up clinical hygiene because I love being a hygienist. And I say it all the time, like dental hygiene, and I don't find it monotonous. I don't find it repetitive. I find every day and every patient is completely different. And I do, and
Mhm.
anyone who knows me knows that I love being a hygienist. So I'll never be able to give that up. Ever, unless my body, I always joke that I'll be like pushing my walker down the aisles to get my patients, right? That will be me. But I stumbled upon my job with Endow because I have never really done sales before. And I called to buy loops, and that's how I ended up with the company. And I really like the culture there. And the majority, not all, the majority of our sales representatives are dental hygienists. And the owner of our company was very insightful in seeing that, she could teach me some sales skills. And I'm learning every single day how to be a better sales representative and understanding that business aspect. But you can't teach somebody how to be a clinician, right? That has to come from before. And all of my years of experience add to my value in this role. So I've been really fortunate, and I'm uh, I'm lucky because most demos for loops consults happen after work. We can't do it in the middle of our day because we don't want to cancel a patient or anything like that. So, and even lunch times aren't enough time really for me to do a proper demonstration and take all of the consultation information that I need. So I always say, let's do it at the end of the day. I can come at the end of my day. How about you meet me after you finish your dinner, and then we can sit and we have uninterrupted time. So I've been really lucky that I've been able to pair both of those together and do both. So it's been really nice. It's
It
been really
shows.
nice.
It shows when you did demo. You got passion for that. Yeah, it's awesome. So
Yeah.
Amanda, I know me and you got to get together for your instruments, specific demo uh, instruments. I'm kind of excited to see the demo, right? And I'm also like I read up on your instruments actually online, and I've actually talked to a few people that have used it, and they actually love it. So um, again, here you are doing hygiene like everywhere, you know your lifestyle is like, yeah, I'm going to work here and then I'm, going to work for your Pacific Dental Company. Like, how do you find all that? How do you kind of just, I think you're enjoying being a sales rep, aren't you?
I am. I like these underdog companies. I came from Dow, right? So all I knew at Dow was Hugh Freedy, 3M, Ivoclar, Sunstar, Oral-B. I didn't know any other product out there. So my goal as a hygienist, because I'm very transparent and I'm going to be honest, I don't sell things that I don't really believe in. Even some of the lines, products we have that I haven't used, I won't even talk about them until I actually use it. Okay. So I do really enjoy it. My goal is to get into the universities and really let them have, I mean, for all the tuition we pay for hygiene and dental school, I think we should have options of what instruments and products we should use. So imagine it's like raising your kid, right? You raise your kid under your house before they move out. All they know is what they know, what you taught them, right? It's just like as students, that's all we know is those 4 or 5 products that are brands I just said. So try to have people change or try other products. That's probably the hardest part of my job, but they just got to trust me. So my job is to have people actually believe and trust me. Like, I hope no one says, I hope she doesn't waste my time because if I'm wasting your time, that means I'm wasting my time and my time is money because if I'm on the road, I'm losing money because I'm not working clinically. So when I get dentists like, hey, can you meet me at lunch? I hope they understand like what that actually means. Like my time is money. That hour, 2 hour that I'm taking to meet with you, I could be paid as a hygienist filling in an office, but out of respect, I want to meet with you and have you trust me with this product. So yeah, I really enjoy it. I enjoy having it's hard to be a hygienist and doing the same thing over and over again at the same office. I work from 8 to 2 straight, usually at offices. I leave at 2. I go do a quick workout. I come back home and I do my sales stuff. I do my emails, my calls, and everything. That's just my lifestyle. And I built my lifestyle to make it benefit me and not anyone else because when I'm good and my mental health is good and I'm relaxed and well rested and taken care of, I'm a better hygienist, I'm a better sales representative, I'm a better sister, friend, just a better headspace.
Gotta apologize for you. First of all, kept on calling Pacific, but it's
That's
Paradise
okay.
Technology. Okay.
I was gonna
And,
correct you,
and,
but it's like,
and,
no, come.
your biggest asset, Amanda, is that you've been with the company for 8 years. Okay. So that really goes, your belief level is up here, right? Because when you're with a company that long, that means you totally believe in that product. Like you're not
And
switching.
I'm being compared to a big company like Hugh Freedy. That's all I knew, right?
Yeah.
So I have hygienists that scale 80% of the time with a Cavitron or piezo because they're actually not that comfortable using a hand scaler. But they only think there's only one option of brands out there.
Yeah.
Like, no, there's me. I'm a hygienist educating you on something that's like ergonomic. And plus, I'm left-handed. I've been squished in a right-handed room my entire life.
That's
So,
painful.
like, really trust me here. Like, life has been hard for me.
Well,
But yeah,
guys,
it's been great.
I really enjoyed this podcast with you guys because you guys are totally upfront. You didn't hold back. If you had one word to describe the future of hygiene before we go, what would it be, Nadine?
It's going to continue to evolve.
Okay,
It's constantly evolving. So we have to evolve how hygiene fits into the business of dentistry. So
I like
it's
that.
going to constantly evolve.
I like that.
Mhm.
Amanda,
What was the question again, Anil?
you had one word to describe how hygiene is going to be in the future. What would it be?
I think we're going to be unstoppable. We're not just going to be independent hygienists, like opening up shop or whatever. I told Nadine this week, I already contacted the College of dental
There.
hygiene in Canada. I said, I want to know why I can't go to Ontario and hang out with my brother who's a dentist and work with him for a week. I have to get registered there. I want to know why a nurse can go and do Botox injections and I worked on cadavers and studied head and neck and I can't do that.
Yeah,
Why can't there be traveler nurses and injectors and there can't be any of that for hygienists?
yeah, I
Mhm.
agree.
I want to break that wall of like, oh, I took an x-ray, I saw a cavity, but I can't say anything because I'm not a doctor.
Yeah, I agree with that 100%. Yeah,
We're
absolutely.
smarter than we look. Or
No,
I look.
yeah. I mean, I've always had respect for your guys' profession because from day one in dental school, I remember, we graduated in 1989. And we didn't have a hygienist in our office. So of course, the doctor, right, winds up cleaning the teeth. And I'm like, oh my God, wish I'd get a hygienist here because I really don't enjoy cleaning people's teeth. And it wasn't the fact of I can relate to the scaling and all this stuff, right? And Nadine said it perfectly. It's like seeing the same thing over and over again, right? That's respect for you guys because I don't really think I could do it. Right. And stuff. I like doing, and Amanda, I know where you're going because you do want diversity, like you just said, Botox and other stuff like that, right? So I agree with you and all that stuff. So
They
it
put
was
us in
all,
a little box. Do you know what I mean? I
yeah,
feel like
absolutely.
as hygienists, like
Yeah.
even look at the pandemic. They didn't even know what to do with us. So they closed us down for a month. They're like,
Yeah,
oh, we don't know what to do yet. We'll close you down for a month. What do you mean you don't know? We're in people's mouths. We got like the worst job you could possibly think of during a pandemic. Like,
yeah, yeah,
you know what I mean? It's just
yeah,
like, where's the respect?
yeah.
Mhm.
Absolutely. Hey, I agree with you 100%. Thank you very, very much for being on the podcast. Okay.
Thank
Thanks
you
for
for
having
having
us. This
us.
was fun.
It was
This
awesome. I
was
enjoyed
great.
it.
I
This
loved
is
it.
therapy, Anil.
Yeah. I don't know if it was therapy for you or me.
It was therapy for me.
It was great. It was great. And
Yeah,
thanks
so
for asking us, questions and asking us like, don't hold back. Say what people are thinking. And,
well, I know both
we
of you
we
guys.
appreciate you
I know
and
both of you guys, and I knew
and
you wouldn't
taking
hold
the
back.
time to see our point of view.
Yeah.
Absolutely. I loved it. So hopefully it'll be online tomorrow, and I'm going to enjoy putting it together. And again, thank you very, very much for being on this Speakeasy Dental. And I'm sure we're going to meet. All
Yes.
right.
Thank
All right.
you.
All right,
Thanks
Bye.
so
guys.
much. Bye guys. Good night.